Hello, everybody. It's Carin Andersen here with Aortic Hope for this week's Week in Review. If you're not familiar with what Week in the Week in Review is, it's an opportunity for us to talk to you here on our YouTube channel and share with you some of the posts that we had up on our other social media platform channels. So let's get started. I'm going to go ahead and share my screen here with you, and we're going to get started with our movement for movement. Now, before I do that, I do want to ask everybody to please click like. Makes me feel really happy. Please click subscribe and hit the little bell so that you're notified every time we go live. This way you don't have to try to remember, which we know is sometimes difficult in this community to do. So let's talk about our movement for movement. We started a movement for movement way back in 2020, ironically, before COVID became a thing. So, excuse me, this was started in January. And basically, what it is it's our recognizing that the community sometimes can feel a little cardiac paralyzed, right? Not all of us bounce right back to marathons or 5Ks or even walking the block. A lot of us tend to feel really scared with the diagnosis of an aortic aneurysm or a diagnosis of some type of heart valve disease, whether it's congenital like a bicuspid valve or non-congenital like aortic stenosis or regurgitation. And those of us who have survived an aortic dissection, we really feel kind of uncomfortable once we've been discharged to home with starting any type of routine that looks at all physical. I can only say that as a person who's had a baby. When I found out I was pregnant, I was scared to sneeze. So you can only imagine what it feels like after you've had surgery to decide that you want to be active, even though your doctor tells you to. And the whole point of our movement for movement is to help you stay motivated in doing whatever it is that your physician has cleared you to do within reason of how you're feeling. And we recognize that sometimes doing nothing is doing exactly what you need to be doing, right? So, movement is actually a promise kept. It's not a performance judged. And I love this quote because I'm utilizing it now, even while I'm in cardiac rehab, having had my valve replaced and my graft replaced and a bypass done, as well as a dissection. So that's another key thing here. All of us here at Aortic Hope, all 20 some volunteers and our 9 board members, all of us have aortic disease. All of us have experienced some form of the disease, whether it's having an aneurysm, having an issue with our aortic valve, or having survived a dissection. So when we say we talk the talk and walk the walk, we mean it. Somewhere along the way for people, it's become something that we have to perform. It's something that gets tracked. Sometimes for some people, it's something that gets timed, it gets posted, it gets measured, it gets compared. But for all our heart warriors, all of the survivors, all of our caregivers and supporters, movement for us is something that's far more sacred, right? It's a promise. It's a promise that we're going to care for our body that carried us through surgery. It's a promise that we're going to try to strengthen our heart that keeps us beating. It's a promise that we're going to show up for our future self gently, consistently, and faithfully. You don't owe anyone a fast pace. You don't owe anyone a perfect form. You don't owe anyone a highlight reel. Walk around the block, that counts. Seated stretches, that counts. Physical therapy session, that counts. Your decision to try again today absolutely counts because it's all about intention. If you set forth the intention that you're going to move in some way, shape, or form, then it counts. Movement's not a stage either. It's a commitment. And every time you choose to move your body at some point in the day, in whatever your body allows you to do and your doctor, you're keeping that promise to yourself. So we ask the question, what promise are you going to keep today? It's an important question. A lot of us are in gloomy, rainy weather. Keep a promise to yourself. Remember, your performance isn't being judged. And that's your Movement for Movement Monday. All right, let's move on to Topic Tuesday because, as you know, I just lost my Tuesday. Let's put that back up there. You know what? We're just going to open it up right from here because I'm technologically not understanding what to do. All right, Tuesday. this month, we are talking about the different types of diagnostic testing that can happen when you have aortic disease. And we've talked about a couple so far. So we are going to talk about a TEE. That stands for transesophageal echocardiography. So this post comes to you from Alvaro, who is one of our med students. All of our medically related posts are written by med students and or residents. They're not written by ChatGPT. Okay, so transesophageal echocardiography, or TEE, is an advanced ultrasound technique that's used to obtain high-resolution images of the heart and the thoracic aorta. And instead of placing that ultrasound probe on top of the chest, you're actually going to be put to sleep with some mild sedation, and the probe is going into your mouth down your esophagus. Very exciting, right? And the reason is because that lies directly behind the heart. So your esophagus goes in and goes behind the heart down into the stomach. And so because it sits so close to the heart and the aorta, the TEE provides clearer and more detailed images than your standard echocardiography in most situations, or in many situations at least. So here's a diagram of a patient laying on their side. Typically, you will have like a square thing that's put in your mouth that helps kind of keep your mouth open. You bite down on it. It's wrapped around your head. You're comfy. They give you that nice, wonderful propofol. You fall off blissfully asleep. Prior to that, you are going to have to drink and gargle a nasty drink. It's a nasty lidocaine type drink. It does not taste good. You are going to, I don't like it, but you're going to drink it, lay down, and you're going to feel really good very quickly and close your eyes and wake up. But in that time when your eyes are closed, the doctor places the TEE probe into your mouth. It goes down into the esophagus and it sits right behind the heart. And sound waves actually create the pictures of the heart. Your stomach is way down here, okay? It's down there. Why the esophagus? So think of it like trying to take a picture through a wall versus standing right next to the object. In a regular TTE, or transthoracic echocardiogram, ultrasound waves have to pass through the chest wall, the ribs, the sternum, the lungs, everything. With the TEE, the probe is positioned directly behind the heart, allowing the doctors to see those structures a whole lot clearer. And that makes it especially useful when you're evaluating your aortic valve, or any other valves for that matter, especially your aortic root and the thoracic aorta. So it can actually see detailed visualizations of the aortic valve, the mitral valve, tricuspid valve, left atrium, and left atrial appendage. I don't know how to say this word because I'm not a doctor. Hold on. Interatrial septum. Whew. Aortic root, ascending aorta, descending thoracic aorta, prostatic heart valves. And so because of this, the TEE is actually one of the essential tools that is used in cardiology, cardiac surgery, and aortic surgery. And when is it used? So doctors use this when they need a more precise information than your standard echo can provide. And so what they're typically evaluating is the valvular heart disease, sets all of your valves, detecting any infective endocarditis, looking for blood clots in the left atrium, or diagnosing aortic dissection in the thoracic area, assessing thoracic aortic aneurysms, guiding structural heart procedures. During aortic surgery, the TEE can play a critical role. It helps surgeons really evaluate the heart and the aorta in real time before, during, and after the operation. So before surgery, you might be scheduled to have a TEE, and that would help confirm the location and the extent of aortic disease, whether the aortic valve is actually functioning properly, and the presence of any aortic regurgitation. And during surgery, the TEE would help the surgical team guide cannulation for cardiopulmonary bypass. That's super important. Monitor heart function, and also evaluate the repair or replacement of part of the aorta. After you've had a repair, before finishing your actual procedure, the TEE is used sometimes to confirm that there's normal blood flow, that there's proper valve function, and make sure there's an absence of complications such as a leak or residual dissection. So for surgeons, the TE kind of acts like this real-time imaging guide that helps ensure that any repairs are done successfully before the patient leaves the operating room. So during the TE, you're going to receive some type of sedation or anesthesia, and this very thin ultrasound probe will be gently inserted through the mouth into the esophagus. The probe emits ultrasound waves that bounce off of those cardiac structures, and those echoes are converted into live images of the heart and the aorta. The procedure really only takes about 15 to 30 minutes, but during surgery, they may keep it in place to continuously monitor the heart. So it's a powerful imaging tool that provides high resolution views of the heart and the thoracic aorta, and it has this ability to visualize cardiac structures in detail, which really makes it essential for diagnosis, surgical planning, and interoperative guidance, especially during complex aortic surgery. So hopefully you found this to be very informative. I know I've had quite a few of these, both before surgery, probably during my surgery. So you don't wake up with a sore throat. You don't need any assistance breathing during this, so you're not going to be having a breathing tube as well. It's no different really than having your colonoscopy or an endoscopy. Okay, it's kind of like an endoscopy. It's just looking at something different, and it's a different type of tube, but it goes in the same place. So that is your topic Tuesday, and I hope you guys found that informative. Okay, let's move right along to Thursday. The reason we skip Wednesdays is because on Wednesdays we have a contest that we do on our Facebook page. So if you do have Facebook, please follow the Aortic Hope Facebook page. In addition, we have some private forums. We have one specifically for grief, which is, for those individuals who have unfortunately lost family or friends. We have one for caregivers only because they have their own set of special needs and thoughts. And we have the Aortic Hope private forum, and that's open to anyone, whether you're a patient or you're a caregiver. And we also have the Aortic Hope Canada page. That's for all of our Canadian friends as well. So check some of those out. All right, listen, we've been hearing, reading, seeing a lot of hints and posts that basically are talking about Think Aorta, even though they don't want to say the words. All of the organizations that exist to provide services to the community, to the aortic disease community, all innately subscribe to Think Aorta, whether they do it formally or not, because if a physician wasn't thinking about the aorta and weren't in a position where they diagnose somebody with a dissection or an aneurysm or bicuspid valve or another valve disease, then we wouldn't be in business, people. We wouldn't be here to support you. So yes, we all think about the aorta, but one of the things that Think Aorta came up with a couple years ago was the hashtag Think Aorta, Think Family. And there's a lot of buzz going around on some pages about this as well, but that's what they're referring to. We know that aortic disease runs in families, and it's much more common than you think. So if you're in doubt, if you should be concerned, then you need to have it checked out. So in doubt, check it out. So the key here is knowing your family medical history. That's really going to potentially save lives. This is a given. We know that there is a potential genetic component to a lot of the cases we see, but not all of them, okay? But it's important to start that conversation with your loved ones and learn about conditions that run in your family, because you might discover that there's been cancer throughout your family, and then you should probably have a screening, right? To be preventive, to be able to diagnose something sooner and then be able to treat it faster. It goes the same with aortic disease. Actually, what we want is we want you to talk to your family and find out, has anybody ever had an aneurysm? That's including the brain. Anywhere. Have they had a history of aneurysms? Has anybody in the family had an aortic dissection? That goes without saying. Was anybody in your family ever born with a congenital heart defect like a bicuspid aortic valve, which means that their valve did not have 3 leaflets or cusps, which is what normally occurs in the formation of a baby? Were they born with 2 or 1 or 4? More common, it would be 2. Was there sudden death in the family where an autopsy wasn't performed and people just decided it was a heart attack? Because without an autopsy, there's no way to know if there was actually a heart attack. So, if any of these situations, or if there's even a highly inflammatory disease component that runs in the family, like lupus or Crohn's disease or colitis or RA, rheumatoid arthritis, or ankylosing spondylitis, which we know has a direct connection to the potential for aortic disease. Your family members, specifically if it's you, your parents, your siblings, and your children, need to be evaluated. So, what that means is it doesn't necessarily mean they have to go have genetic testing. Nobody's going to genetically test your children or your siblings or your parents unless you have a known defect or issue with your genes, because they want to know what they're looking for. If you don't have anything today, caveat, because it doesn't mean you won't tomorrow, you can at least consider having your children or your family members receive a baseline CT or echo or MRI, some kind of testing that would show the size of their aorta, that might also show how well their valve is functioning, and is it a normal aortic valve or is it a bicuspid, for instance. At least have the baseline. Nobody will grow a bicuspid valve. It doesn't happen. It's formed at birth. So if you find it, there is a chance that another family member, offspring, or sibling might have it as well, and therefore they should be evaluated, as we talked about last month, because bicuspid valves can tend to cause aneurysms further down the line. And here's the deal. Aortic dissections, they are rare. I know it doesn't feel rare to the person who's had it or the person whose family member has had it, but they are rare. And aortic disease, valves and aneurysm, it's more common than people realize. And the good news is, as I mentioned, simple imaging tests like a CT scan or an echo can really help determine if you might be at rest. So just remember, however it's worded, 2 words, think aorta. So simple, but saving the lives of so many. Aortic disease runs in families. It's more common than you think. And if you're in doubt, check it out. Start that conversation today. Know your family history and protect your future ASAP, because awareness saves aortas, period. That's your Think Aorta Thursday. All right, we're going to move on to Friday. As you know, the first Friday of every month, we launch a new fundraiser for the month. So in March, we launched our awareness card decal. It is a small decal, but with a big impact. If you want to save lives for more than the cost of your morning coffee, and actually including the gas that it takes for you to drive to get that morning coffee, say hello to the Aortic Hope card decal. Here it is. Yours for just a $5 donation. That is anywhere in the world. We will send it. No shipping. Yours with a $5 donation. That's it. $5, $5. You can put it on your car, obviously. And when there's traffic, that just became outreach. That just became education. You can put it on your laptop, right? Or your Surface Pro. It makes Zoom almost a little bit more meaningful, right? You can put it on your window in your house. Let awareness shine right through. And you can also, of course, put it on any water bottle if you don't already have an Aortic Hope water bottle. And look, hydration plus education, a winning combination. Any smooth surface that needs a purpose can use this decal. This decal might be small. It could be small, right? But it is mighty. It sparks conversations, it raises awareness, and it could be the reason that someone learns something life-saving about aortic disease. So $5, 1 sticker, unlimited impact. All you need to do is you can click the link here in that blog post or go to Hope Shops. If you go to Hope Shops and you scroll down past the books that you can order, the very first link includes all of our swag, which are magnets and decals and our help belts. Okay, that is your Think About It Thursday. I'm sorry, your Fundraiser Friday. I'm getting confused with my days of the week. All right, let's move on to our Survivor Series Saturday. We've been doing Survivor Series since 2017. That's a long time. What we do that sets us apart is we don't interview anybody. I don't pretend to know, in this case, everything you would want to know from another survivor. I do ask questions of physicians and clinicians, but in this case, we feel that the Survivor Series are most effective when the patient or caregiver just gets to tell their story. That's it. And with us, presently, you have two different ways you can do that: by a recorded message that we will produce with you, or you can do it in written form. Okay, we want you to be the shining star in someone else's life by sharing your story. I actually was talking to someone the other day, and the person said, I don't know how interesting anybody's going to find my story. And I said, let us be the judge. And when I read it, I was so interested, just like I was with Quentin Hoffman here. And remember, whether it's aortic valve disease, aortic aneurysms, or dissections, your ability to validate another person's experience, it's not only therapeutic, it's so inspiring. So inspiring. Help us show others how to thrive and not just survive. There is a link here to click on our Survivor Series. Or, hey, how about this notion? If you've already been part of our Survivor Series, we want to know what you're doing now. We started Where Are They Now? Almost 6 years ago. No, wait a minute, 18. No, 8 years. It's been 8 years. 8 years since we started this program. So we want to know what you're doing, because some people are thriving. Other people feel like they're just surviving, and both stories are valid and will validate other people's experience. But this past Saturday, we are so pleased to share with you this incredible story of Quentin Hoffman, who just 5 months ago, suffered an aortic dissection. And we want to say thank you to Quentin. We're honored to have your contribution, and I'm going to read the story now. Good evening. My name is Quentin Hoffman, and I reside in Salisbury, North Carolina. I'm a battalion chief for their 911 center, and I'm a lieutenant at my local fire department. Thank you so much for the work that you do. 33 years old and a survivor of a type A dissection. On the morning of October 26, 2025, it started out like any other morning. Woke up early, took my oldest daughter to the bus stop, and then went to the grocery store. I came home, put the groceries away, and did some light, non-stressful work around the house. That afternoon, I was sitting on the couch and felt the urge to sneeze. And when I sneezed, my life took a turn for the worse. I immediately felt a pop in my chest and also could hear it. Also, at the same time, my arms went completely numb from my shoulders down, and my legs went numb from my hips down. My heart rate increased, and my heart was pounding. I tell people it felt like someone was in my chest cavity banging on the chest wall with a hammer. Me being the stubborn EMT/firefighter I am, I waited 15 minutes before calling someone. My best friend happened to be working at the fire department that day, and I called him to come by the house to check me out. I fully say that he was the one that saved my life. After taking my blood pressure, he immediately knew something was very wrong and got on the radio to call for EMS. When I went to stand up to get on the stretcher, I collapsed to the ground because I couldn't feel my legs. At this time, I was also sweating profusely, and I had to be carried outside onto the stretcher to be placed on the back of the ambulance. I spent 5 hours in the ER while they were trying to diagnose me with a pinched nerve in my neck. In my back. All while I was having chest pains, cold sweats coming and going, elevated heart rate, heart still pounding, an abnormal EKG, and my troponin levels were climbing. If it wasn't for the oncoming night shift physician, they would have sent me home. This is a story we hear way too often. He ordered the CT angiogram, and that's when they found it. I was rushed to Wake Forest Baptist Hospital, where I underwent emergency open heart surgery. As I was on the way there, I started deteriorating. And within 20 minutes of arriving at WFBH, I was put under for surgery. That's when everyone realized how extensive my dissection actually was. My surgeon took a total of 12 hours, and my dissection was 21 centimeters long. On top of that, I'd blown out my aortic valve, and it had to be replaced with a mechanical one. I also had damage to 2 other valves that had to be repaired, and those valves supply blood to my brain, and they were worried I would suffer a stroke. Thank goodness that didn't happen. I woke up 2 days later in the cardiac ICU, and my doctor and surgeon came to see me once I was coherent. And he told me that he's been performing these surgeries for a very long time, and he's never seen someone that had a dissection as extensive as mine. He told me that there's typically a 24% survivability rate, and mine was at 1%. He said that when it popped, I should have died right then and there, and it almost and to make it almost 7 hours after it all happened, by the time he had surgery, I was a walking miracle. I went on to spend 2.5 weeks in cardiac ICU where I was bedridden until finally made it to the patient rehab where I spent another 2.5 weeks learning how to walk again. And it's been almost 6 months and I'm still working on my strength to be able to do more. I have a great support system with my parents and my beautiful wife and some great friends. I still have a long road ahead of me, but I'm a survivor. Yes, you are, Quentin. And I will be reaching out to you to have you drop off some Think Aorta posters to your hospital and into that fire station. Thank you so much for the work you do. And thank you for sharing your story. We truly, truly appreciate it. Okay, Friday was all about kintsugi. I don't know who's ever heard of it. I should have brought my bowl upstairs to show you. Every time I do this post, I forget to bring it. Kintsugi is the Japanese art of putting broken pottery pieces back together using gold, like a gold epoxy. And I'm sure you can use other colors if it comes in other colors. The whole goal is to embrace your flaws and imperfections to create something even more beautiful and stronger than before. So it is the Japanese art of repairing broken pottery with gold, basically embracing the cracks, not hiding them. Each fracture becomes part of the story, stronger, more beautiful, and uniquely resilient. For those of us living with aortic disease, survivors of an aneurysm, dissection, or aortic valve surgery, you understand this deeply. I know you do. Your scars, your journey, your healing, they're not flaws. They're just proof of strength, courage, and survival. At Aortic Coat, we believe in honoring every part of that journey. Like kintsugi, we don't erase what's been broken. We don't try to fix it with fluff. We just try to be honest and genuine and lift it up, share it, and hope that we find some hope in it. You're not broken. You're rebuilt. And you're stronger in the places that once felt impossible, both physically, mentally, spiritually, and emotionally. And so that is your Feel Good Friday post. And if any of you want to do that, you can go to like Michael's or a dollar store and pick up just a bowl because they're all made out of some type of pottery. And all you need is really some colored epoxy and a little piece of cheesecloth or like a what do they call it? Towel, like a kitchen towel. Cover it, use a little teeny hammer, just kind of crack it in like 2 places, 3 places. You don't want it in little chunks, you want it in big. And once it's big, you'll use the gold to fill it in and kind of put everything back together and then give it about a day or a day and a half to dry. And I'm telling you, it looks better than it did before. It's got such character. The flaws are phenomenal. You try it and you let us know. Okay, we're going to talk about our events real quick. I need to update this. I'm so sorry. If you go to our events page, any of these in red, you can click on, they take you to links. So all at the top are support group meetings. If you're a caregiver, you click here. If you want to join the general group, you click here, Canadian and bereavement. Our Spanish speaking group is still being built and put together. So today is the 23rd and I'm getting ready to go to cardiac rehab. We have our last general support group meeting of the month happens the last Wednesday of every month. That is happening this week on the 30th. I'm sorry, on the 24th at 7 p.m. Rob will be bringing you his week in review next Monday on the 30th at 3 p.m. And that evening we have our WISE group, which is Women Inspiring Support and Empowerment. That is it for the month of March. I will tell you that in April, we have a couple pretty exciting things. I believe that there's an interview taking place from our friends at Aortic Athletes. We will be going live with Tara Cohen with Lawrence Hope. So if you've ever thought about getting a medical identification bracelet, they have so many sporty, waterproof crystals, things that are a little bit more feminine, more masculine, neutral, dog tags. They have so much. You need to check it out. We always give away something to someone. And right now we've got those gift cards for some upcoming contests, which is why you have to click subscribe so that you can follow us and find out when these things are happening. I do want to give a shout out to the 2026 sponsors, Cook Medical. At Cook Medical, they innovate and manufacture quality medical devices to improve our lives. They focus on bringing compelling products to the market and keeping existing ones relevant. With headquarters in Bloomington, Indiana, and global manufacturing facilities, their aim is to increase their impact worldwide. And Edwards Life Sciences, they're the global leader of patient-focused medical innovations for structural heart disease and critical care monitoring. And at Edwards, they really listen to their patients when they talk. And the reason why is because patients, we provide them information about our experience with their products, which can help them improve their products. I've got an Edwards valve in me right now. Our stories continue to help them fight on our behalf, and they can really provide comfort and support between themselves and to us, and to help us also have an opportunity to connect with other patients. If you'd like to learn more about Edwards Life Science, you can click on their resources here. Just click on any of these logos, and we will be talking about some of the others at another point in time. So, that is that, right? I'm going to stop sharing my screen here and just say thank you so much for joining this week's Week in Review. Again, don't forget to click like, click subscribe, and share this, because I guarantee you someone else out there is going to take away something very valuable by sharing this information. And we appreciate you being with us. And until next time, we will see you soon. Take care. Bye-bye.